We have a number of treatment options for the various interstitial lung diseases, from immunosuppressive therapies like mycophenolate mofetil to targeted biologics like tocilizumab, antifibrotics like nintedanib and pirfenidone, and then the medication recently approved to treat complicating pulmonary hypertension, inhaled treprostinil. We're not there yet, and we've still got a long way to go. I think that we are still, there's still a lot of room for other drugs to come to market. Patients will still die from their ILD and IPF. And the good news is that there are a lot of different drugs in various stages of development, from phase 1 to phase 2 to phase 3 clinical trials. So I think the future is bright, and hopefully we'll have further therapies available for our patients within the next couple of years, provided some of these studies turn out positive. The patients that we see will typically be referred by other pulmonologists. So they come with knowledge that they have interstitial lung disease. It's very unusual for us to say, aha, thought you had COPD, thought you had asthma, but no, you actually have interstitial lung disease. That can happen, but it's uncommon. So patients come with a diagnosis of interstitial lung disease in various stages of workup. Sometimes, depending on who's referring them, they've had a full workup and the diagnosis is known, and they come to us for further management. And sometimes they'll come in with just, have ILD just discovered, go see Dr. Nathan and his group, and they'll do the whole workup and come up with the appropriate management plan. But for the most part, patients do come in with some kind of knowledge of their interstitial lung disease. Of course, that varies. You have patients with different levels of knowledge, different levels of sophistication. So it is a bit of a spectrum. Sometimes you tell a patient, so you know you have interstitial lung disease, and they actually don't know, even though I'm pretty sure that their doctor had mentioned it to them.